Churchill to answer the substantive question tabled by Sir Edward Davey. Minister Churchill.
Thank you very much, Mr. Speaker, and I'd like to inform the House that we will be grouping 11, 12 and 13 together. I would firstly like to place on record my thanks to everyone on the front line, be they in a hospital, be they in social care, but also some of those less obvious places like my community nurses, pharmacists and others who are working ceaselessly on the front line. We are working round the clock to make sure that everyone across the NHS and care sector has the personal protective equipment that they need. To date, we've delivered more than 1.11 billion items of PPE. We're ensuring that PPE is delivered as quickly as possible to those on the front line. We've delivered to over 58,000 health and care organisations, and we are working closely with industry, social care providers, the NHS, NHS supply chain and the Army so that all our NHS and care staff can get the protection that they need.
Sir Ed Davey.
Thank you for that answer. But given how care homes have become a tragic focus of this pandemic, with so many staff and residents losing their lives, when will the Minister be able to guarantee that every care home will have all the PPE they need? And why is the Clipper system that's meant to supply PPE to the care sector now 1 month late?
Right Honourable Friend for his question. Every NHS and social care worker must have the protective equipment that they need. But turning to Clipper first, Clipper has been rolled out. It's important that Clipper actually is able to deliver the products that are ordered online. This is now being rolled out to more than 1,500 different general practices and care home providers. And as it is piloted and as it is stood up to more and more individual organisations, that will help ensure that that stream of work ensures that people have the personal protective equipment that they need. That is on top of the NSDR line where people can ring in case of emergency, but those are also backed up by the wholesale distributors where only this last week 52 million more items were placed into that line as well.
Go across to Jacob Young. Jacob Young.
Thank you, Mr. Speaker. Across Redcar and Cleveland, we have fantastic businesses like Pendraken Miniatures and BCFX who have switched their manufacturing lines to making visors. The Materials Processing Institute, who has switched to making hundreds of bottles of hand sanitizer for Marie Curie nurses every week, and 15-year-old Daniel Sillett, who is using his 3D printer to make PPE for local care facilities like Mask Hall. Will she join me in commending these businesses and individuals as part of our national effort in overcoming this crisis?
Thank you, Mr. Speaker. I would indeed like to join my honourable friend in congratulating him and for the way he's just explained that this is the most enormous national effort from large-scale businesses down to those individuals like Daniel, to whom we must make a special thanks. This national effort and the way individuals and businesses have stepped forward, the many offers from all the different suppliers, has been extraordinary. We are working with industry partners across the piece to make PPE with INEOS and Diageo to produce hand and hygiene products and to make sure that we get these to the front line using services like Clipper. Thanks to the work we've already seen, we've seen novel products arrive on the front line. 7 companies have now been contracted in the UK to make over 25 million items of PPE and some 6 million square metres of fabric to the NHS supply.
Jonathan Gullis, going across to Jonathan Gullis.
Thank you, Mr. Speaker. And like my honourable friend from Redcar, I have Scrubs for Stoke and the Hayward Academy who have produced amazing amounts of PPE to our local healthcare sector. Can Mr. inform us what steps to make to ensure that community staff in care homes and domiciliary care in particular, whether it's the country of kids talk and across the country, are receiving appropriate infection control training to ensure that they're able to make optimal use of PPE and minimise transfer of infection from one client to the next?
The Minister could answer that.
Certainly. I would again like to pay tribute to businesses in his area, and I think the crux of his question was about people making sure that people are receiving the appropriate infection control training in order to utilise PPE effectively. We've published clear guidance, including videos, which are easier to watch and immediately understand the appropriate PPE for health and care workers based on clinical expertise. The guidance has been written and reviewed by all 4 UK public health bodies and informed by NHS infection prevention control experts, and is consistent with World Health Organization.
I think we're going to have to speed up the answer, unfortunately. I now welcome Liz Kendall in her new role. Liz Kendall.
Thank you, Mr. Speaker. I've listened carefully to the Minister's answers, but on the ground there are still serious problems. Maria, who's a care worker in the North East, told me on Friday she's only just received face masks and has to wear the same one throughout the day. Kenzie in Leeds told me exactly the same thing. One mask all day, even though one of the elderly ladies she cares for has coronavirus and can't help coughing and spitting on her mask. With almost 8,000 deaths in care homes so far, will the ministers tell us what changes she will make and what she will do differently to get a grip of this problem, which is still increasing, and help bring this terrible death rate down?
Minister.
I thank the Right Honourable Lady for her question. As I said, there are the 3 strands of guidance, making sure that the appropriate equipment is used in the appropriate place. We have also used the local resilience forums in order to ensure that individual care organisations can have a backup of personal preventative equipment so that people can use it in line with clinical guidance. I will contact the Honourable Lady after this, because I would like to ensure that the young lady she spoke about has seen that guidance and the videos that accompany it in order to make sure that she feels properly protected, which is the aim of us that we're all working for.
Substantive question, Alex Shelbrooke. Minister.
Thank you, Mr. Speaker. NHS England and Improvement have published detailed guidance setting out the support for NHS dentistry during the pandemic. To minimise the spread of infection, routine dentistry is currently suspended. NHS practices are providing a telephone advice and triage on urgent dental centres to patients with urgent needs. NHS dentists will receive their usual remuneration in full or in part if they do part NHS, part private. Dentists can also seek help via all the Treasury means for lost earnings.
We go across supplementary. Alex Shelbrooke. Alex Shelbrooke.
Thank you, Mr. Speaker. My constituents in Elmet and Rothwell have reported difficulties in obtaining emergency dental care in Leeds. Can the Minister detail what actions the Department is taking when the specific issue to say Leeds comes up so that patients can access emergency care during the lockdown?
Minister.
Thank you, Mr. Speaker. Of course, as of the week ending the 30th of April, there were 2 UDCs in the Leeds area providing urgent dental treatment and care to patients on referral from either a patient's own dentist or from referral from NHS 111. As with all urgent dental care centres, there is a referral service. The triage will give people either advice, antibiotics or painkillers, and then referred through if clinical work is required. There are 308 urgent dental centres open across the country. I regularly talk to both the Chief Dental Officer and the British Dental Association about the needs and requirements in the profession so we can care for patients best.
Minister's substantive question, Sarah Jones. Minister.
Thank you very much. It's vital we find out what groups are most at risk so we can help protect them. That is why we've asked Public Health England to conduct a rapid review of the different factors that might influence how someone is affected by the virus. Amongst other things, they will explore age, ethnicity and gender. As our Deputy CMO outlined yesterday, this is important but complex work.
Sarah Jones.
Thank you, Mr. Speaker. And I'm sure the Minister would want to join me in paying tribute to the staff at Croydon University Hospital and in our local community for the resilience and the bravery and the good grace they have shown during this crisis. Over 250 people have died in Croydon, and we are all thinking of their families and their loved ones who will be suffering so much. High levels of deaths in Croydon appear to be down to the underlying health of the population. Although, of course, it's early days in terms of analysing the data, it is clear that in Croydon, COVID has affected people from BAME backgrounds disproportionately. Does the Minister agree with me that on early sight, it looks like poorer people, and often from BAME backgrounds, are being hardest hit by COVID, and that we need to tackle the longer-term underlying health issues that have got us to this place of gross inequality?
Minister.
Thank you, Mr. Speaker. As I say, I think it's so important that we do the research before we draw the conclusions. Every death is a tragedy. Everybody who has died during this pandemic is somebody's mum, dad, brother, sister, and therefore we owe it to them to give Public Health England and all those researching into this area all the support we can, so that we don't rush to conclusions, but that we draw conclusions that will truly help us address this pandemic and those who are most affected by it in the right way.
I'm sorry we didn't get more questions in, but maybe we can speed up the teams next time. We'll get through some more questions. We now come to the urgent question to the Secretary of State for Health and Social Care. I will follow the practice for substantive questions whereby I will call the Secretary of State to answer the question first. Before doing so, I have a short statement to make which is relevant to this urgent question. It's been widely reported that the Government will make a major announcement about the review of lockdown this Sunday. I consider this a matter of regret. It is important that the press is kept informed, but it is the duty of this House to hold the Government to account, not the media. Major Government's announcements should be made first in the House, and this is more important than ever during this time of crisis. I now call the Secretary of State to answer the urgent question from Jonathan Ashworth, as on the order paper. Secretary of State.
Thank you very much, Mr. Speaker. Mr. Speaker, we have flattened the curve of this epidemic, ensured that the NHS is not overwhelmed, and expanded testing capacity to over 100,000 tests a day. And Mr. Speaker, as a government, we are working resolutely to defeat the coronavirus. And there are two important areas where I want to update the House today. First, the expansion of our work to test, track and trace. We've now built a national testing infrastructure of scale, and because we have this extra capacity, we'll be delivering up to 30,000 tests a day to residents and staff in elderly care homes, making sure that symptomatic and asymptomatic staff and residents can all be tested. Our care system represents the best of us, supporting our loved ones with tenderness and dedication at their time of greatest need. And through this unprecedented expansion of testing, we can give them the certainty and confidence that high-quality testing can provide. Mr. Speaker, second, we're working to build the resilience of the NHS. We currently have 3,387 spare critical care beds in the NHS. And that is not including the capacity provided by our Nightingale hospitals, including the 460-bed Sunderland Nightingale, which opened earlier today. We should all be very proud that we've built up the NHS so fast, and that our collective national effort has helped to protect the NHS and flatten the curve. As a result, we are now able to start to restore some NHS services, and we're in a position to be able to place the London Nightingale on standby. This is good news because our NHS has not been overwhelmed by this crisis and remains open to those who need care. And that means that this nation's shared sacrifice is having an impact. Throughout its time, Mr. Speaker, this chamber has borne witness to so much, and it's borne witness to the nation's resolve once more. And I'm delighted that the British people are well and truly rising to this incredibly difficult challenge.
I now call Jonathan Ashworth, who is asked to speak for no more than 2 minutes. Jonathan Ashworth.
Thank you, Mr. Speaker. Our thoughts, as always, are with the loved ones of those who have lost someone to this awful disease. And can we again pay tribute to our brave NHS and care staff? Can I say to the Secretary of State that clapping and campaigns for medals are appreciated, but does he agree that NHS and care workers deserve fair pay, mental health support and access to PPE. I'm hearing reports that we may have problems with the stocks of sterile gowns. Could he just update the House on that front, or write to me if he's not able to do so today? We also rely on international staff, as he knows. Will he scrap the health surcharge that they have to pay? It seems particularly unfair at the best of times, but especially at this time. We are tracking towards having one of the worst death rates in the world. We've seen the figures again today. I know he said we are through the peak, but can the same be said of the care sector, given the numbers of deaths we've seen in the care sector reported today? He knows we support lockdown, and it's right we engage in a debate about lockdown. The strategic aim must be to suppress this virus, not simply flatten its spread, in order to save lives and minimise harm. And testing, tracing and isolation is crucial. Does he agree that we should be mobilising our expertise in local authority public health services and other specialists like environmental health officers, and expertise indeed in primary care? Wouldn't that be a better route than outsourcing the call centre work to firms like Serco? We support digital tools, but he will understand there are questions around privacy. Could he undertake to publish a data protection impact assessment? As we heard in question time, deprived areas experience COVID mortality rates more than double those in less deprived areas. There are disproportionate mortality rates amongst Black, Asian and minority ethnic communities. Doesn't this show that COVID thrives on inequalities, and we need a funded strategy to support low-paid, deprived and marginalised communities, including enforcing protections in the workplace when we transition out of this lockdown? Can he comment on the remarks of the Chief Scientific Advisor at the Select Committee earlier, who said that we imported many cases from Italy and Spain early on in March? This was when, of course, events were going ahead like the Liverpool Atletico Madrid event. What advice will he be taking when we transition out of this lockdown as to ports of entry, testing at ports of entry and quarantine? And on a final point, Mr. Speaker, we are building up a huge backlog of unmet non-COVID clinical need in the NHS. What resources will be available to deal with that unmet clinical need, and how will we get these waiting lists down? Because we do not want to see excess mortality and morbidity because of the lockdown affecting those with non-COVID.
Secretary of State.
Thank you very much, Mr. Speaker, and I'm grateful to the Shadow Secretary of State for his questions. He's quite right to raise them. If I go through as fast as I can and respond to them in turn. First on gown supply. Gown supply is improving, and we have a better distribution system of PPE that we've been working incredibly hard on under the leadership of Paul Dighton, Lord Dighton, who has come in to help on PPE, and it made a significant improvement already. He asked about the number of deaths in the care sector. Now, of course, this is incredibly important to make sure that we protect those who live in social care, who receive social care in their own home. I'm glad that in the numbers released this morning, the data released by the Office for National Statistics, the number of deaths in care home is slightly lower, but it is still far too high, and there's a huge amount of work still to do. He rightly asks about making sure that we suppress the virus. This is the goal, not just to flatten the peak, but to get the numbers right down. And in doing so, our local authority, public and environmental health teams will be absolutely vital. He's right to draw attention to them. We often praise, rightly in this chamber, the NHS and social care staff, but I think this is a good moment for us to come together to praise our public health officials, our environmental health officials in local authorities. And then finally he asks about the non-COVID needs. These are incredibly important. People who need treatment should get that treatment, and we're opening up and reopening the NHS, including, Mr. Speaker, any temporary closures that may have taken place, for instance in A&Es, that need to reopen. And I can think of one example in Chorley, sir, which we're working hard to reopen as soon as possible as the NHS reopens, and I'm happy to put that on the record. It is slightly unfair sometimes that you as Speaker, sir, can't ask open constituency questions, but I know it's something you have worked incredibly hard on along with your colleagues in Lancashire. And finally, I want to really reiterate this point about levelling up. The government's agenda of levelling up is unabated. In fact, it is strengthened by this crisis. There are many reasons for the disparate impacts of coronavirus on different groups, and the Public Health England work that's urgently underway into, for instance, the impact on ethnic minority groups, on obesity, on in terms of deprivation, and of course the much greater impact on men rather than women. All these things need to be considered and looked into, and we need to level up our country once this crisis is over.
I welcome the comments from the Secretary of State, but we now go over to Sir Peter Bottomley. Sir Peter.
Can I ask if we can all recognise the loving care by social services staff and NHS staff, especially those who have to go on hot or cold visits to people's homes, the community nurses, the dementia nurses, the people with special needs, but also the GPs, paramedics. And can I ask the Secretary of State if he'll consider safer ways of those home visits, possibly using some of the offers of London black cabs, which have divisions between the driver and the clinician, and also much easier to clean down when necessary.
Secretary of State.
Yes, Mr. Speaker, I'm happy to look into all different ways of having safer working practices within the NHS and more broadly, of course. Within the NHS, infection control is a critical piece of work. And the point that the Honourable Gentleman raises, and is right to raise, is that this is not just a matter for acute hospitals. Of course, there it is mission critical, but it's a matter for all parts of the NHS, including, for instance, pharmacies, which increasingly have screens to make sure that there's a lower impact of transmission from customers to staff.
We now go across to the SNP's spokesperson, Dr. Philippa Whitford, with 1 minute to place a question. Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. At least 140 health and care staff in the UK have lost their lives to COVID-19, and we should pay tribute to them. But analysis of over 100 of these tragic deaths has highlighted that there weren't any among staff in critical care units, the most dangerous setting. So does the Secretary of State recognise this shows the effectiveness of full PPE? He claims to always follow scientific advice, but NerveTag, the viral threat advisory group, advised him last June to add gowns to the stockpile. So why didn't he do that? And why did Public Health England produce PPE guidelines for the whole UK that didn't recommend gowns for staff looking after COVID patients?
State.
Well, thank you. We do absolutely, we are absolutely guided by the science. It's a very important principle of our overall response. And hence we upgraded the PPE guidelines a few weeks ago to include the use of gowns. The guidance, of course, is always looked into as we learn more and more about this virus. And of course, the plans that we had were not plans for a particular virus, but for the threat of a pandemic. And then we've learnt more and more about this virus, which is novel and only came into being in December last year. Hence, as the science changes, so they update the scientific advice to ministers, and ministers update decisions.
We go across to Miriam Cates. Miriam Cates.
Thank you, Mr. Speaker. At the start of this pandemic, with no effective drug treatment, the only way to save the lives of coronavirus patients has been to make sure that hospital treatment is available for all who need it. So can I thank my right honourable friend for overseeing such a massive increase in critical care bed capacity. And we saw yesterday that NHS Nightingale in London isn't due to take any more patients. And while some have oddly criticised this announcement, does my right honourable friend agree with me that this should be viewed as nothing other than a success and shows how effective we've been in protecting our NHS?
State.
Thank you, Mr. Speaker. Yes, I'm incredibly proud of the work that was done to put in place the Nightingale hospitals across the country. Most of them put in place in under 2 weeks. And the London Nightingale, which of course came in, was open first, is the prime example of the whole team, NHS, private sector, the armed forces, all pulling together. And it was a great accomplishment. But a greater accomplishment still is that it was never full. and that this country has managed to flatten the curve. And now that we're able to put it on standby, meaning that it'll be physically there in case there's a second spike, but as an insurance policy rather than as an active hospital, that is a very, very positive step which should be welcomed by all. I tend not to take much notice of some of the noises off which sometimes criticise me for not having full enough hospitals, sometimes criticise me for not having enough people wanting test capacity. Frankly, we'll get the capacity up and then hope we don't use it. That is the attitude we should take to the extra hospitals, and I pay tribute to everybody involved in the project.
Go across to Yvette Cooper. Yvette Cooper. We'll have to go across to Stuart Anderson. Stuart Anderson. Stuart Anderson, we've got it. Stuart Anderson.
Thank you, Mr. Speaker. We all know the importance of PPE during the outbreak and how difficult it is to get it and the great lengths you're going to procure it. On the weekly calls with New Cross Hospital and the City of Wolverhampton Council, the same point is at the forefront of our discussions, and it's the consistency of the PPE deliveries. Could my right honourable friend set out what plans he has in place to ensure that what is promised arrives?
Secretary of State.
Yes, my honourable friend's quite right to ask this important question, because getting the distribution of PPE to the front line is a critical part of it. It's been a huge operation. The head of the army has called it the largest logistical operation that this country has seen in 40 years. And it is a challenged one because there is a global shortage of supply. So we're working to get that supply as effective as possible. It's undoubtedly improving, but it's also, there's an awful lot of work still to do. Having the national shortage call centre and the phone line that anybody can call if there is a shortage coming up is an important part of the response. So too is the automated online deliveries for the smaller settings. But we continue day and night to try to do everything we can to improve the flow of PPE to the front line.
We go across to Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. Disabled people are worried about who's expected to provide PPE for personal carers. Many are finding it difficult to procure appropriate equipment, and when they can, they are finding that prices are inflated. Can the Minister outline what the government is doing to ensure that disabled people are not left without adequate equipment or out of pocket when attempting to protect themselves and their carers?
Well, she's quite right that making sure that our whole social care system gets access to PPE is important. There's often a focus on PPE in hospitals and in care homes, but also on home visits, as she quite rightly raises. The access to PPE is vital. There has been a global increase in prices of PPE. The prices that the government pays for PPE has increased a number of times over the course of this crisis. That is a feature of having a global shortage of supply as the demand for PPE across the world has shot up. We're seeing this the world over. What I hope to do is bring on stream more and more domestic manufacture of PPE, both to make sure you can get the quantity, but also to see if we can stop those price rises from happening.
Go across to David Johnson. David Johnson.
Thank you, Mr. Speaker. Elderly constituents of mine in Wantage and Didcot have been concerned by media reports suggesting they'll be forced to stay in their homes for an extended period of time. Can my right honourable friend confirm this is in fact not the case, and through all the work he's doing on testing and the tracking and tracing app, that he's working to make sure we can all return to a normal life as soon as possible?
Secretary of State.
Yes, I'd like to take this opportunity, and I'm grateful to my honourable friend for his question, just to set out the exact policy which has been got wrong by a few media outlets in the last few days. We set out from the start and clearly on the nhs.uk website that there are broadly three groups of people in terms of the strictures of the social distancing guidelines. There's people of working age who do not have underlying health conditions for whom we must follow the social distancing rules. There are those who are in groups who are, by the science, more susceptible to this disease, including the over 70s and some with underlying health conditions, for whom we say they are clinically vulnerable and must pay particular attention to the social distancing rules. Then there is the group that are shielded. In these cases, these are people who have specific underlying health conditions and will have received a letter from the NHS. It is only this last group that we have said, right from the start of social distancing, that they will need to stay away from people as much as is practically possible for 12 weeks. We know that this is a very significant impact and burden, and hence we've written individually to these people, and in many cases they'll have some specific requirements because of their condition. It's really important that people understand these three separate groups, and I hope that that clears up for the House some of the confusion which has been seen on the front pages of some of the newspapers.
Ruth Cadbury, we go across to Ruth Cadbury.
Thank you, Mr. Speaker. The Sunday Times this week had an extremely moving piece by photographer Stuart Franklin featuring NHS workers and patients fighting the coronavirus at West Middlesex Hospital, which is based in my constituency. Now, the article demonstrated very clearly the emotional impact of the virus on frontline health and care staff, as well as patients and their families. And we all know that post-traumatic stress syndrome will be a growing issue for many through and after this. So will the government invest in both immediate as well as long-term mental health treatment for all those affected? And will this take into account that many particularly health and care workers, are often reluctant to seek help?
Secretary of State.
Yes. The Honourable Lady makes an incredibly important point. I agree with every word of the question that she's asked. We are investing already in more support for the mental health of frontline workers, making sure that there are resources available to all. And of course, at the moment, there are challenges to delivering that because of social distancing, but I commit to continuing and strengthening that over the long term. It's something that I've thought as important throughout my time as Health Secretary. I pushed this agenda even before coronavirus, and now it's even more important, and I look forward to working with her on it.
Go across to Dean Russell. Dean Russell.
Thank you, Mr. Speaker. Across Watford as a volunteer, I've seen firsthand the many inspirational frontline workers, ranging from pharmacists to hospital volunteers, GP receptionists through to cleaners. So can the Secretary of State confirm that everyone on the front line will have the full support of government, so nobody is missed out who works on the front line as we continue our incredibly important fight against coronavirus?
Secretary of State.
Yes, Mr. Speaker. It's a big team effort, and all play their part. And you know, people have different roles, of course they do, and people have been incredibly flexible on the front line in terms of the roles that they play, but all play a critical part and all deserve our support.
We go across to Munira Wilson. Munira Wilson.
Thank you, Mr. Speaker. In order to test, trace and isolate to keep people safe and save lives, testing must work properly and be widely and locally available. So I was astonished to hear that yesterday, people in my constituency were being sent as far afield as Brighton, when we have a testing site right here at the RFU in Twickenham. Other key workers tested last week at Twickenham have had their tests lost, and no one in the NHS can find them. And we are also hearing reports that people sent home testing kits have no return address to send their completed tests to, yet those tests are being counted. So will the Secretary of State please confirm, how are people being prioritised for testing at their local sites? How many tests have been lost at some of those drive-through sites and those that have been sent to people's homes? And when does he think that we will be doing enough testing to actually move to test, trace, isolate to keep people safe, like so many other countries have been successfully doing for several weeks now?
Secretary of State.
Thank you, Mr. Speaker. Well, we do have now one of the largest testing capabilities in the world. We're testing more people per day than Germany, and I think that the whole country should be reassured by that fact. And of course, there are individual examples of where the logistics go wrong. That's natural in any very, very large system. I'm very, very interested if she could send me the details of those specifics, then we'll look into them. But what I would say is that the availability of testing now across the board is huge. It is big enough to start the Test, Trace and Track programme. We're piloting that, as she knows, in the Isle of Wight from today, and then we'll roll it out across the country.
We now go across to Dr. Luke Evans. Dr. Luke Evans.
Secretary of State, in one of your earlier answers, you very kindly went through the definitions of all the different vulnerabilities and groups that are out there. Definitions are really, really important, especially as we start to consider lockdown and indeed releasing it. When that point comes, will he be crystal clear on exactly who is entitled to do what and when, and make sure that everyone in the public knows exactly that?
Secretary of State.
Yes.
We now go across to Caroline Lucas. Caroline Lucas.
Thank you, Mr. Speaker. Can the Secretary of State confirm that directors of public health and environmental health officers won't just be consulted, but that they'll actually be leading the delivery of community tracking and tracing efforts, given that that's what they've been trained to do? And can he really reassure us that the government won't be repeating the mistakes it's made with drive-through testing centres and PPE supply by outsourcing those critical tasks to private companies like Serco, Sodexo and Deloitte, who frankly have simply proved that they are not up to the job?
Secretary of State.
Well, I agree with the first part of her question. She's completely wrong in the second part. The first part of the question asked whether the local public health officers and environmental health officers will be a critical part of Test, Track and Trace, and the answer is yes, they will, absolutely vital. The second part, she's completely wrong. There is no way that we could have delivered the testing programme without the unbelievable support, help and effort of private partners, both in the diagnostics industry and in delivery, companies like Deloitte and Boots, who delivered that amazing expansion of the drive-through centres in such a short period of time. I pay tribute, hand on heart, to the work of every single person in that programme, whether they worked in the private sector or the public sector, whether they worked in the NHS, in the department, for Boots, for Deloitte. And frankly, to try to divide people in that way, I think she's missed the tone of where the country is at that right.
Felicity Buchan.
Thank you, Mr. Speaker. In order to get London back to work, we need safer public transport. Does my right honourable friend agree with me that the Mayor of London needs to provide more tube trains to provide a safer service for Londoners?
Secretary of State.
Yes, I do, because the more people are spaced out on public transport, in terms of the distance between them, the safer that public transport will be. And I think the Mayor of London, I hope the Mayor of London is working extremely hard to have as full a service as possible, so that as few people as possible can be on each individual service.
We go across to Ben Lake. Ben Lake.
Speaker. Widespread testing and contact tracing will be essential to contain future outbreaks, and such a system will need to be operational before we move from full lockdown. Now, in addition to the Isle of Wight trial, will the Secretary of State consider the work being undertaken by Ceredigion County Council in collaboration with Hywel Dda University Health Board and Aberystwyth University on a community testing and contact tracing system that could offer local solutions and expertise to complement any UK-wide infrastructure?
Secretary of State.
Well, I'm happy to look at any examples that are effective of reducing the spread of the virus. Of course, parts of this are devolved, parts of it are the UK government's responsibility, and we've made available all of the tools that we're developing at a UK level for devolved governments to pick up. For instance, we've published the underlying source code behind the app so that people can have a look at it and suggest improvements or take it and use it in their own way.
We go across to Nigel Mills. Nigel Mills.
Thank you.
Many of my constituents with cancer understood when their treatment was deferred, but are now keen to resume it, but nervous about going to hospital in case they catch coronavirus. Can he assure them that their treatments will resume and it is safe for them to go to hospital to have them?
Secretary of State.
Yes, I want cancer treatments to resume as soon as is safely possible. Now, in some cases, it is clinically not advised to resume treatments because there is the spread of the virus about in the community, for instance, treatments that reduce immunity to very low levels. But there's other areas, for instance, some of the surgery that we are able to restart. It's a very, very important part of the restart of the NHS. And the message I'd give to my honourable friends' constituents is that if you are advised by your doctor to go to hospital, then you should go to hospital, because they will have taken into account all of the different risks and decided that that is the best advice to give. So if you're asked to go to hospital by your clinician, please do go.
We go across to Catherine McKinnell. Catherine McKinnell.
Thank you. The government chief scientific advisor said that if we can keep deaths below 20,000, we will have done well in this epidemic. Yet the death toll now stands at a devastating 32,313. And it's not about whether we can use international comparisons. This is the government's own measure. And so there are many wondering how the government can claim its approach so far to be a success. Is it not an insult to every family member who's lost a loved one, as well as undermining of public confidence that the government is learning from its mistakes?
State.
We are absolutely learning from everything that's happened and constantly looking again. And trying to make sure from the time we get up in the morning to the time we go to bed at night that we have the best possible response. That includes, for instance, working cross parties where the cross-party work can also help, as we have done on the test, track and trace pilot in the Isle of Wight. That's the approach that we constantly take. Of course, we look at all of the information and all of the data, but she's also should acknowledge, I think, in that spirit, that it is a success, that the curve is flattened and now coming down, and critically, that the NHS was at no point overwhelmed. That was one of our priority goals right at the start, and that has been achieved at every point so far in this crisis. So whilst, of course, there are always things that we can improve, I think we should also rightly study the things that have gone well.
We go across to Jack Brereton. Jack Brereton.
Thank you, Mr. Speaker. My right honourable friend, thanks to this response of the British people in Stoke-on-Trent, we have prevented our NHS from being overwhelmed at any point during this crisis, meaning it has been able to offer world-leading care to every single person who's needed it since the very first case.
Yes, Mr. Speaker. This comes off the back of the previous question. You know, there were many people, not more than a few weeks ago, saying that we wouldn't be able to get through this crisis without the NHS being overtopped, not being able to have enough capacity to deal with the number of cases. And through a combination of the expansion of the NHS that we've overseen and the public doing their bit by following the social distancing rules, we've managed to avoid that outcome, and instead, at every point in the crisis, the NHS has been there to provide the care that's needed as much as it possibly can, as well as it possibly can, and hasn't been overwhelmed. And that is something that this country can always look back on.
We now go across to Chris Bryant. Chris Bryant.
Thank you. My inbox has been packed for days with questions from over 70-year-olds saying that they simply don't understand what the government advice is. Is it that none of them should ever, whatever their medical circumstances, however healthy they are, leave the house for 12 weeks? When did the 12 weeks begin, and when will the 12 weeks end? Or is there going to be another 12 weeks? And further to that, I asked the Secretary of State on the 3rd of February whether face masks worked. He was very sceptical about them at the time. Will he be advising people in the future that we should all be wearing face masks on public transport? And if so, where are we going to get them?
Secretary of State.
Thank you, Mr. Speaker. I just want to reiterate again the point that I made in questions earlier, and I hope that in response to all of his constituents, he will send them the NHS website where the answer to his question was set out extremely clearly right from the start. And it is very clear that there are three groups of people. If you have received a letter from the NHS saying that you must shield for 12 weeks, then you are in that category. If you have not, then you are not. And I know that there's been some media reports that have stated otherwise, but I would really implore people to follow the guidance clearly set out on the NHS website, which he and any other member who has questions on this should send to inform their constituents. It's a matter of our public duty, it's not a matter of political debate.
We go across to Joy Morrissey. Joy Morrissey!
Thank you, Mr. Speaker. What provision has my right honourable friend made for the visually impaired during COVID-19?
Secretary of State.
Thank you very much indeed, Mr. Speaker. Getting new government guidance to the visually impaired is, of course, a challenge. It's something that we've been working hard on. In the first instance, the first port of call should be primary care, somebody's GP, or 111 if there are any queries. That's where I would point people to in the first instance. It has been a challenge because we've been making policy at speed, writing guidance and updating guidance at speed. But I would point people, those who are visually impaired, to 111 and their GP if they have any questions.
We go across to Martin Day. Martin Day.
Thank you. The Trace Together app in Singapore has been downloaded by 17% of their population since it was introduced in March. What estimate has the Secretary of State made of the numbers that will be required to download the NHS app? And have there been discussions about making it compulsory if not enough people do so?
Secretary of State.
Well, the more people who download the app, the better it will be and the more effectively it will keep people safe. However, even small numbers downloading it will help us to spot hotspots, and so will bring some value. I was really delighted overnight, yesterday afternoon, to hear from Isle of Wight Radio, Mr. Speaker, who stated that 80% of people in an early survey said that they wanted to download the app on the Isle of Wight. And that would be a terrific result. I pay tribute to the work of Isle of Wight Radio and the local press on the Isle of Wight, who have taken with enthusiasm to the Isle of Wight's important role in piloting this rollout. But there isn't a numerical answer to the honourable gentleman's question. The answer is as many as possible will make us as safe as possible.
We go across to Laura Farris. Laura Farris.
Thank you, Mr. Speaker. I welcome the launch of the Test, Track and Trace app, but one of the apparent challenges is that those who could benefit from it the most, namely the elderly, may be those who are least likely to be able to access it because they don't have a smartphone. What assessment has my right honourable friend made of the probable lower take-up by that vulnerable cohort?
Well, we have looked into this question. It's a very important question. And of course, Test, Track and Trace is a system. The app is one part of it, but human contact tracers are an important part of the system, as is the advice we give to people to contact their own significant contacts themselves. And so the whole system has been designed knowing that a proportion of the population don't have smartphones. There are many older people, of course, who do have smartphones, and I'm sure, for instance, the Shadow Secretary of State is probably sending a message to his parents right now on the smartphone, but that he's using instead of listening to the honourable lady's question. The point I'm trying, there's a serious point though, which is, of course, we've had to take that into account. It's another reason why the Isle of Wight is such a good place to trial, because there are elderly residents on the Isle of Wight, and we'll work out and learn a lot from how effective that trial is.
We go across to Abena Pongasari. Abena.
Thank you, Mr. Speaker. It has become apparent that people from Black, Asian and minority ethnic backgrounds are being disproportionately affected by COVID-19. People in Erith and Thamesmead have also raised concerns about the disproportionate effects of COVID-19 on disabled people, people from low socio-economic background, women and children. Does the Secretary of State have plans to publish a report into the effects of COVID-19 on people who fall under one or more protected characteristics?
Secretary of State.
Yes, we've today launched a piece of work by Public Health England to look into the disparities in the impact of COVID-19. But I'd just pick her up on a couple of points in the question, which is that the evidence shows quite clearly that the impact of COVID-19 is lesser on children and lesser on women than it is on men. And also, there's growing evidence that obesity has a big impact. We've got to look into all of these considerations and and we'll listen to the scientists and the medics and learn whatever lessons that we can.
We now go across to Heather Wheeler. Heather Wheeler!
Thank you, Mr. Speaker. I thank my right honourable friend for his answers and congratulate him and all the hard-working staff in the NHS and carers for looking after us. Would he support my campaign to have a memorial placed at the National Arboretum at the heart of the country as a fitting way to commemorate the sad loss of essential workers to COVID-19?
State.
Well, yes, I'd be very happy to look at that and to discuss it with my right honourable friend. It is important that as a nation we remember and we commemorate the sacrifice of those who have lost their lives while serving on the front line of this war. It's a war in which we're all on the same side, and we should commemorate those who have given their lives in it.
We go up to Kirsty Blackman in Scotland. Kirsty Blackman.
Thank you, Mr. Speaker. The 7-day average number of new cases in the UK has now levelled out at 4,500, but it isn't yet decreasing significantly. Can the Cabinet Secretary tell us what the number of new daily cases must fall to before he believes test, track and trace could prevent another peak if restrictions are eased?
Secretary of State.
Well, one of the 5 tests that we have set out before the restrictions are eased is that the number of deaths should be falling consistently. And indeed, the Scottish Government document has a similar proposal, and we're working closely to make sure that the UK is as aligned as possible.
We go across to Sir Christopher Chope. Sir Christopher!
Thank you, Mr. Speaker. Does the Secretary of State agree with you, Mr. Speaker, that changes to lockdown should be announced to Parliament first? And the Secretary of State said earlier that transparency is the lodestar of government policy. If that is correct, will he now release the findings of exercise Cygnus and prove that that is not just a gesture, but is actually the real policy of the government?
Secretary of State.
Well, thank you very much. The decision over the release of exercise Cygnus, that was an exercise that was undertaken under my predecessor, and there are specific rules in government around decisions over the papers of that were produced before one's time. So I'll take away the point that that was mentioned.
27 withdrawn. We go across to Claire Coutinho. Claire Coutinho.
Thank you, Mr. Speaker. There's some evidence that under 10s are at a much lower risk of both getting and transmitting the virus. If true, this would be a huge comfort to both teachers and working parents. What evidence has the Secretary of State seen, and what work is being done to further explore this?
Thank you. There is strong evidence that the under 10s are less likely to have symptoms of coronavirus, but unfortunately the evidence on under 10s transmission of coronavirus is mixed, and there isn't a conclusive scientific base on that yet.
We go across to Steve McCabe. A brief question from Steve McCabe.
Is the Secretary of State content that the advice and guidance given to pregnant women working in frontline health and social care, both on safety and income, is sufficiently clear and consistent?
Secretary of State.
Yes.
We now go over to Steve Baker. Steve Baker.
Mr. Speaker, I congratulate my right honourable friend on the fruits of his tireless work along with officials and others in government, like delivering mobile testing in Wickham. But could he please tell us a little bit more about what he's doing to restore the full range and scale of elective surgery in the NHS so that people with non-COVID conditions can get their treatment back on track?
Secretary of State.
Well, this is a really important point, and it's critical because the overall impact of coronavirus is not just on the direct morbidity and the number of deaths of those who die, sadly, from coronavirus itself, but also on the wider impacts, including those whose treatment has been delayed because of the necessity of ensuring the NHS was ready to cope with coronavirus, or because for clinical reasons it was important to delay the treatment because there is such a virulent virus at large. And so we're working very hard to restore those treatments for non-COVID reasons. That work has started. I was able to announce last week, for instance, that fertility treatment has restarted, cancer treatment is restarting, and other elective surgeries will restart as soon as it's safe to do so.
We go up to the north to Alistair Carmichael. Alistair Carmichael.
Thank you very much, Mr. Speaker. From Orkney, in fact, this weekend, I've been receiving reports from Category 2 key workers who self-referred for a COVID test through the gov.uk website, then at the end of it being directed to testing centres in Thurso, Elgin or even Peterhead, all of which would require a journey by ferry or by plane in the first instance. Mr. Speaker, there is local provision and there is the option of postal testing. Could we get the website sorted so that people get the information that they need rather than be left thinking that in order to get a test, they have to first get a plane or a ferry?
Secretary of State.
Well, thank you very much. I'm glad that we sorted the broadband to Orkney so that we could take the question. It's a very important question. I'll look into the specifics of it to make sure that our island communities get the appropriate response in the website. He'll appreciate we put the testing website together at remarkable pace, and so in the first iteration weren't able to make this sort of nuance, important nuance for Orkney and other island communities. But I'll take that away and look at it. He mentioned the answer to this in substance, and the answer is to get the home testing kits working for Orkney, and I'm sure there's a way through.
Go across to Angela Richardson. Angela Richardson.
Thank you, Mr. Speaker. The Royal Surrey Hospital in Guildford, under excellent leadership in partnership with our community, has proven resourceful and innovative, ensuring best practice for patient care, safety for staff, and ability to continue treatment for patients presenting with non-COVID-19 needs. Feedback from these patients has been very positive. Will my right honourable friend join with me in paying tribute to our NHS leaders, once again encourage those who need hospital appointments and urgent care to attend? And finally, will he give assurances that hospitals like mine, who are world leading in cancer treatment, will get the investment that they need to ramp up diagnostics going forward?
Yes, absolutely. I think we've all learned that the importance of diagnostics during this crisis, and if we didn't know it already. And I pay tribute to the Royal Surrey, to the leadership and to the staff there who have done such a magnificent job, including treating friends of mine for coronavirus. And I want to say to anybody in Surrey that if they get a message, if you get a message from your doctor saying that you need to go to hospital, then you must go. This is important right across the country, in fact, in Guildford and beyond.
We go across to Bill Esterson. Bill Esterson.
We still need to significantly increase the number of people being tested so we can tackle the crisis. Companies like Curative are supplying tens of thousands of saliva-only tests to the US military, but have faced roadblocks trying to supply in the UK. So what is the Secretary of State going to do differently to improve procurement of tests so that companies who want to help can do so?
State.
Well, we are working with many companies on the expansion of testing, including new technologies. We've got to be confident that the technologies are effective and work, because a test that gives a wrong result and has too high a proportion of wrong results can be worse than not having a test at all. So I'm not saying that's the case in the individual specific example that he gives, because we're working with many companies on how the next generation of tests can be brought to bear, but it is important that we get this right as we ramp up testing. There's clearly a pressure to increase testing. Sometimes, Lyndon Johnson once said, politics is about what have you done for me recently. It's only last Thursday we hit the 100,000 target. I don't mind being urged to do yet more, but we've got to do it using the right tests in the right way.
We go across to Sir Desmond Swain. Sir Desmond!
Thank you, Mr. Speaker. What prospect is there of moving to robust, multi-use personal protection equipment that can stand being decontaminated many times?
Yeah, the right honourable gentleman, with probably the most spectacular backdrop to any questioner in this session, is right to raise this issue because, and it is happening. The right personal protection equipment that can safely be decontaminated and reused is being decontaminated and reused, and it is an important part of the solution to the challenge of getting the right PPE to the right people right across the board. It doesn't work in all instances. It's got to be safe first and foremost, but it is a part of the solution. He's right to raise it.
We go up to Manchester to Afzal Khan. Afzal Khan.
Mr. Speaker, the British Medical Association, the Faculty of Public Health, and the Royal College of Physicians have all advised the government to suspend the fees for migrant accessing the NHS during the coronavirus pandemic to ensure universal access to healthcare. We know that charging regulations disproportionately affect BME people, and given the impact of COVID-19 on wider BME communities, will the Secretary of State now suspend the charging regulations?
These regulations are important because it is important that people make a fair contribution. The question has been raised in relation to staff within the NHS, and in many cases in terms of staff in the NHS Trust themselves pays the extra, which is a contribution towards the running of the NHS, and that's the approach that we're taking.
We go over to Deepest Chipping Barnet, Teresa Villiers.
Thank you, Mr. Speaker. The Secretary of State's aware of my concerns about the discharge of patients with COVID symptoms from hospital into care homes. Can he provide the House with reassurance that there won't be such discharges, that COVID-positive patients will not be discharged into COVID-free care homes because of the risks that they might spread the infection to other residents?
My right honourable friend and I have been in discussion about this important issue, and we have strengthened the rules around discharges to ensure that anybody being discharged from hospital into a care home gets tested, and then that they are isolated ahead of the result of that test. If the test is negative, then of course they can go into the home in the normal way. If the test is positive, then of course that isolation must continue until they're through the virus and they're safe to go into the care home without taking coronavirus into the care home. I'm glad to see in the latest numbers that the number of those who are dying from coronavirus in care homes is just starting to fall, but there's an awful lot more that we still need to do.
We go over to Kirstin Oswald. Kirstin Oswald.
Thank you, Mr. Speaker. The Secretary of State said earlier that the Tracing Act would have privacy by design, and it will be critical that there's a high degree of public confidence in the app if it's to work as he intends as part of efforts to trace the virus. So what data protections will be put into place to ensure the public are confident
that this tool will be secure and that data can't be misused?
We can have confidence, not least because the data is held on your own phone and until you need to contact the NHS, when naturally, of course, you need to tell the NHS your identity in order to be tested. And so in that sense, privacy is in by design. There's a wider point, though, which is that the app and the test, track and trace system will help keep people safe. And as I said yesterday, when launching the pilot in the Isle of Wight, download the app to protect the NHS and save lives. It is on the Isle of Wight. It is your civic duty to do so, and across the country, it will be your civic duty to do so. It has been designed with privacy at its heart by design. We're putting the code, the source code, on the internet so people can see exactly what this app does. I think that reassurance, along with the motivation that you are helping to protect yourself and protect your community, I think, and I hope, will lead to an awful lot of people downloading the app. I certainly will.
We go across to Edinburgh with Peter Bone. Peter Bone.
Mr. Speaker, further to your opening remarks at the beginning of this urgent question about new policy being announced by government in the House and not to the media first. The Secretary of State sidestepped the question when it was put to him by my honourable friend from Christchurch. So I'm going to try again. Secretary of State, do you agree with the Speaker that statements should be made first of new government policy in this House? Or would you advise the government that they put off making the statement on Sunday to Monday and have a statement in the House?
Secretary of State.
Thank you very much, Mr. Speaker. Well, the exact scheduling of that of any announcement is, of course, a matter that has to be considered across government. But I will take away my right honourable friend's concerns and ensure that they're looked into.
We go across to Stephen Farry. Stephen Farry.
Thank you, Mr. Speaker. In better times, tens of thousands of people cross the land border in Ireland every day. And more generally, the UK and Ireland are committed to the common travel area. Therefore, in terms of contact tracing apps, does the Secretary of State recognise the difficulties that would arise from the UK, including Northern Ireland and Ireland, using different systems? And will he undertake to work with the Irish government to address any such operation issues?
Well, we have considered all the different potential apps being used by different countries around the world, and we are. I'm confident that any such concerns about international travel can easily be addressed, not least from the potential to have two different apps on your phone if you need to travel internationally.
We go across to Dr. Julian Lewis. Dr. Julian Lewis.
My right honourable friend has proven himself to be a brilliant multitasker. So would he kindly turn some of his attention to a firm in my constituency that has access to a network of manufacturers in southern China that believes it can supply 1 million items of gowns, visors, masks, and other PPE equipment per week if only someone from government would get in touch. I'm very happy to text him the details directly, but I've been trying for 3 weeks and still government have not got in touch with this firm.
Yes, of course. If I get the details, I'm very happy to do that. I'd also be very happy to know where the right honourable gentleman got his hair cut, because it's extraordinary. Nobody else has got such smart hair. Everybody else is looking rather increasingly bushy.
We go across to Alex Sobel. Alex Sobel.
Thank you, Mr. Speaker. Dozens of dentists have got in touch with me, Secretary of State, saying that the measures put in place aren't protecting them and their practices. They take on a combination of private and NHS patients. Many are fearing bankruptcy and ultimately closure. this will leave NHS dentistry in an existential crisis. What steps is the Secretary of State taking to ensure that NHS dentistry survives the current crisis?
Thank you, Mr. Speaker. This is an incredibly important question, and my honourable friend, the Parliamentary Undersecretary, is working very hard with the British Dental Association and others to make sure that dentists get the support that we need.
We go across to Maria Miller. Maria Miller.
Further to that question on dentistry, I've spoken to local dentists in my area in Basingstoke, and a number feel that they have got the correct PPE and working conditions available to be able to provide the sort of emergency dental care that many of their patients need. So can my right honourable friend just perhaps outline how we can move forward with dental practices in the same way as he's worked so hard in moving forward with the work that hospitals are able to do now, for which I'd like to reiterate my thanks.
Thank you, Mr. Speaker. This is a really important point. I will write to her with the proposed plans for reopening dentistry. It's obviously got to be done in a safe way, and PPE is one important consideration. Dentistry, by its nature, requires close contact, and also can be an aerosol generating procedure in certain circumstances, which makes it a higher risk to the dental practitioner, the dentist or nurse, and therefore by turn to other future patients. So we've got to get this right. Emergency dentistry is available in dentistry hubs that have been set up during the crisis. It's important to get it right, but it's also important to get dentistry back on its feet.
We'll go across to Alan Smith. Alan Smith.
Thank you, Mr. Speaker, and well done getting so far through the order paper. Right? I would ask the Secretary of State that, progress notwithstanding, we're very much not out of the woods yet, and that the European Centre for Disease Control's head has very worryingly confirmed that the UK is among 5 European countries not making substantial progress on cutting the overall rate of infections. Is the Secretary of State concerned by that analysis, and can he reassure the House that we will be taking account the European Centre's data in any calculation about resuming normal activities and easing lockdown?
Well, I haven't seen that particular report that he refers to, but we take into account all data and considerations in making the decisions that we do.
We now go across to Jason McCartney. Jason McCartney.
Thank you, Mr. Speaker. I have a local care home which thankfully is free from COVID-19 at the moment. The manager there is trying to get all his staff tested just to check that they are free from COVID-19 as well. And not all of those staff actually have a car, so they're not able to travel the miles to the local mobile testing facility. Can the Secretary of State tell me what's the best way that that manager can get his staff tested so that they can continue to look after all their vulnerable residents in a safe way, please?
Yes, we are rolling out testing to all care home residents and staff, symptomatic or asymptomatic, for elderly care homes. I announced that at the start of this urgent question. It's an important expansion of our testing now that we've built up the 100,000 tests a day capability. And we'll be doing that in part through mobile testing units, which are delivered by the armed forces, where the testing unit goes to the care home, and then staff and residents alike can be tested at the care home rather than having to travel. Clearly, whether people have a car of their own or not, when you're testing a whole care home, taking the testing to the care home rather than having to take everybody from the care home to a drive-through centre is a much better way of doing it, and I'm very grateful to the armed forces for the part they've played in making this capability available. They've done an amazing job, our armed forces, in this whole crisis, right across the board. The armed forces have stepped up where we've needed them. They've played a critical part in the testing capability. We wouldn't have got to 100,000 tests a day without them. And the example that he rightly raises is just one example of our armed forces playing their part and doing their duty in this crisis.
We're now going to try and reconnect Yvette Cooper. Yvette Cooper.
Thank you, Mr. Speaker. I'm very grateful. The Health Secretary told me that he would make public the evidence behind the government's repeatedly confirmed decision not to ask people arriving at our ports and airports to self-isolate, in contrast to other countries. But that evidence hasn't been included in the SAGE papers published today, even though the papers do say we were affected by many cases arriving or coming back from Italy and Spain. Surely we need to see the evidence and scrutinise it in order to get border policy right. Why has it been withheld?
Thank you very much, Mr. Speaker. I'll look into the question that she raises.
That was the final question. I will now suspend the House for 30 minutes to 2:03. Thank you, everyone. I've just